In this video, we're going to go over another case in the case series of acute subdural hemorrhage. And this is a tricky case mainly because there's a lot going on in terms of other intracranial hemorrhage. We're on kind of a more traditional parenchymal window. We see intraparenchymal hemorrhage. There's subdural. There is subdural hemorrhage, but there's also subarachnoid hemorrhage. So it can be really easy to just look at this on some of these traditional brain windows. It's a little too harsh. We'll do something like that, and then just kind of say parenchymal subarachnoid, and then move on. But again, we have when we're doing our search pattern, we have to leave room to do a search for extraaxial blood products, and that's going to include windowing for extraaxial blood, and then using both our coronal and our axial together to look for these blood products. And as we start to scroll, if we look in our region of interest, already it becomes obvious that there's actually layering blood along where we see that subarachnoid hemorrhage. And if we look at our coronal, this slice shows it really, really well, but we have, small, thin subdural along that convexity there. So, ultimately the finding of intracranial hemorrhage is not subtle, but we want to make sure we detect it in each relevant compartment. So it's important to not get distracted by the other more obvious blood, and always look for the subdural that may be there, may be hiding. And again, windowing and using our reformats is really important for that.